And we are back. Joining us for our final conversation, we have some representatives from different schools in Belize, as well as the Ministry of Health and Wellness, to talk about pink eye and a possible chickenpox outbreak in schools. Joining us, we have Miss Avril Authors, who is the principal of Buttonwood Bay Primary School. Good morning.
Good morning.
To her right, we have Miss Robin Daly Faber, who is a nutrition technical advisor at the Ministry of Health. Good morning. And to her right, we have Miss Marlette Lacayo, the principal and PR personnel at Palote High School. Good morning.
Good
and
morning.
Joining us via Zoom is Mr. Emilio Montero, who is the coordinator at the National Food and Nutrition Security Commission at the Ministry of Agriculture. Good morning.
Good morning, guys. Good morning.
Good morning.
Morning.
All right, thank you all for joining us this morning. This is a topic that I didn't think I would be talking about right now, just because I feel like pink eye and chickenpox are so far away from my norm in my reality. So let's start with the topic at hand, chickenpox and pink eye in schools.
Here to talk about the healthy habits.
The healthy habits.
Healthy schools, Healthy Belize initiative.
Okay,
So
let's start with that.
okay, so this initiative has been ongoing since last year, August. The Healthy Habits, Healthy Schools, Healthy Belize initiative is an initiative that looks at reducing sugary drinks in particular in schools, and also to promote healthy foods in school and also healthy habits.
Okay.
So we have been working along with 18 schools in the Belize district. A total of 4,800 students are impacted, and we have 9 high schools, 9 primary schools, 8 secondary schools, and 3 preschools that are a part of this program. So with us, we decided to invite also some schools that have been doing very well with the program to give their input.
Okay.
This has been a push that is a collaborative effort between the Ministry of Health and Wellness and the Ministry of Education.
Yes.
But it would seem as if it's long in the making. Why wasn't something like this initiated or instituted many years ago? Because I don't know that we need to have health or medical experts to tell us that, you know, consuming sugary drinks for kids is bad for their health ultimately. Why has it taken such a long period of time for us to be able to put something like this into effect?
I believe that, well, the process started with a cabinet paper. I think the monitoring, and also, because some schools have been doing it before this initiative started, but the monitoring and having something on paper that's concrete is where I think, you know, it has taken a time to get that together, but the work has started before, indeed. So schools, we've been doing trainings over the years in terms of nutrition. Nutrition is in the curriculum. So it has been a part of the education system, and also with us at the Ministry of Health, we have seen also the rise of diseases becoming more frequent in children. So even though it has been, I would say, just done at random, and schools weren't being, I don't want to use the word forced, but schools weren't being pushed heavily to get this on board, it has been going on anyways. But due to the cabinet paper that was pushed, and it has been launched at the national level in terms of it's been endorsed by government. And I think that was where we can have more on the ground work being emphasized with something like this being on board. And I just believe that with the high prevalence of diseases, the time has come for us to really do something more intense in terms of pushing something like this, and not just wait for, you know, some schools do, some schools don't, or have it just run in a random way.
How is this being properly monitored? And I'm asking because when we push these or enforce these kinds of initiatives anywhere, we have cabinet paper, we have launches of certain things happening in different places, and then it kind of just goes dormant, right? And then we don't hear about it again until perhaps something else happens. So how are we monitoring to ensure that these things actually stay in place?
We have a collaborative effort with Ministry of Education and also with the schools, and we have a task force. So a task force has been formed with our entities or various entities, our partners, Ministry of Health, Ministry of Education, Agriculture. We have our UN partners, and we all work collaboratively to put things in place for us to look at monitoring, and it's a phased-in approach. I want to stress that. It's not by next week or next month, all the sugary drinks should be out of school. So hearing from the principals here, we could hear about how they have been actually doing their monitoring, because we at the Ministry of Health and even Education, we can't be everywhere at the same time.
Very true.
So we have to empower and engage the schools so they can be able to do their own monitoring, and also for them to feel the responsibility to take charge of their schools to be a healthy school. So
Let's go to Miss Arthur's at the primary level at Buttonwood Bay. Talk to us about how your school embraced this idea, and perhaps what you guys are doing at sort of a local level to be able to address the consumption of sugary drinks at Buttonwood Bay Primary.
Okay, so as you are aware, at primary school it's a bit more challenging as compared to the high school. I mean, anything fatty, salty, or sweet
Kids
is considered nice, right? That's what the students want. So for us at that level, it's a bit challenging. So it's something that we had to phase in. So what we did initially was we selected one day that would have been Healthy Day. We communicate a lot with the parents. We send flyers as reminders so that they know that on this day, students are not supposed to bring anything that is considered unhealthy. And we also have our teachers, we have our wardens on board. The kitchen itself sells things like fruits, so they would have cut up watermelons, cantaloupes, papaya, whatever fruit they have. Things like popcorn, instead of cupcakes, we would have muffins with granola on top, things like that. With consistency, we noticed that the students and the parents started to support this initiative. When we look break time, students are bringing garden salad to have as snacks, right? They're bringing their grapes, they're bringing their apples. Now, when this becomes a habit at the school, it did not limit it only to on Wednesdays. Students were bringing it throughout the week. Apart from that, to try and cut down on the sugary drinks, we have natural juices that we sell at the school. And then on Mondays and on Fridays, we have what is called Water Day. So we encourage our students to drink a lot of water, and this way we're cutting down on the number of sugar that is being sold in the school. And we actually see it working. Students are asking for their water, they're bringing their healthy snacks, and they're eating healthier. And what is very important is the parental support. If we get our parents on board, that's what makes it easier. I mean, we will never get 100%. So we do have one or two students that would try to sneak in these things, but if caught, we confiscate it, right? And they don't want their goods to be confiscated, so they try to work along with us. So that's how we've been doing it at Buttonwood Bay.
Let's start Ms. here from Palote.
Hi, good morning. I just like to make a correction. I'm not the principal of Palote High School. I am the PR.
Yes.
Okay, so at Palote High School, we are dealing with older students, and so it means they are in charge of their money, right?
Yeah.
And so what basically we had to do was have a buy-in to the program. Basically, when students see teachers as role models for stuff, they tend to follow suit. And that is what happened with us. We didn't just jump up and say, okay, healthy, and let's go.
Yeah.
And then we march like militarized. No. It began with us, the teachers, buying into the program. And so for those of us who were very much addicted to soda, Coca-Cola in particular, we made this effort, we made this agreement that we would not bring it onto the school compound, and we would support the cafeteria, and we would be that example. So I must say that has helped like tremendously. Also, education is key. And so not just telling them, well, don't eat this, don't eat that, but we tapped into the disease component of it because they're older children, they have better understanding. And so because of the stage that they're in too, they are a little more conscious of how they want their bodies to look. And so we use that as an opportunity to help guide them in making better choices. We are very blessed at Palote in that we have a very responsible Yum Yum. We don't call it cafeteria, we call it Yum Yum. And so the girls are served fresh meals every day. The cutting out of the soda in particular was a tremendous effort that we made. We made sure that we added fruits to the roster that it was right at hand at school. In particular, we have apples and bananas every day at school. And I must say, you don't stay on the shelf.
That's good.
So that is a positive for us. Water was always a big thing at Palote because one of the subjects that the girls do is physical education.
Yeah.
And so they drink a lot of water. In fact, one of the requirements for them to get their grade is to have their water bottles and consume that water throughout their sessions. So yes, so basically we don't believe in being Dracula, and so we have our little cheat days, like I said, phasing in. Like for example, the fried foods are monitored. Like we would have fried chicken and fries maybe once a week, and so that really helps. The girls also got to voice what they, in the beginning, what they felt was working for them from the menu and what wasn't. And I must really commend our Yum Yum personnels, really flexible, and they cater to the girls in what they wanted a little bit more of, that made them feel, okay, I love this, I like that. In terms of vegetables, we do a really, really good coleslaw that is not greasy and fatty. So they get fruits, vegetables, water, and the foods are baked for the most part, not fried.
Okay.
In terms of other snacks, we have latched on to the chips that is baked rather than fried, and so even that. So we have been making tremendous strides.
Wonderful.
Let's get Mr. Montero in on the conversation this morning. He's from the National Food and Nutrition Security Commission. Mr. Montero, talk to us about the role that you play in this initiative.
Yes, good morning, Council. Thanks for the invitation. Yes, to add to the conversation that my colleagues are talking about, the healthy eating as it relates to, of course, the Ministry of Health and Education. Also, School Gardens is for the Ministry of Agriculture. So if we are going to promote eating in schools, we also need to provide an option to our schools. And this is where the Ministry of Agriculture comes in, where over the years, we have been supporting as many schools as we can with their school gardens, growing their vegetables like cabbage, lettuce, tomatoes with peppers, cucumbers, and so forth. But also a new component that we're adding in as a result of the promotion of healthy eating in schools, we also need to talk about fruits. So our ministry also engages in the donation of fruit trees to schools in as much as we can. So this is where the role of our ministry comes into the conversation of what Robin and my other two colleagues from the schools are talking about.
Okay. Well,
and that's where our major contribution is coming from as well.
Awesome. I am actually glad that you're here, Mr. Montero, because when we were in school, I don't know about you, Insani, but when I was in high school, we were basically supported with an agriculture subject. You grow your food, you carry it home. Your A is basically if you could plant something and it could actually survive for the semester, and you take it home, you make something out of it, and you come back and share. Are these some of the strides and initiatives that we're hoping to see in the coming year with this healthy practices and so forth.
Definitely. That's a big part. Food security in particular, it focuses a lot on being able to have food, to grow your food, to being able to be sufficient.
Yeah.
So the agriculture component is very critical to this program as a part of the healthy habits. Because if we want children or young people or even us as adults to move away from processed foods, which is unhealthy and causing diseases, we have to more use natural foods. And how do we get natural foods? We have to get back into gardening. We have to get back into planting. It has been missing from some schools, but like Mr. Montero mentioned, it's something that we need to continue as we have been working together for a while. So having school gardens is not new, but we need to, just scale up and have more involvement with schools utilizing it. And also it could be used as a teaching tool as well. But actually getting children excited, and those who have gardens, they know. As I was talking to Miss from Palote, and she was telling us about the garden experience that they have at the school. And I don't know if you want to share a little bit about that.
Okay, so this just happened. We didn't plan it, but now that we think about it, it's all good. It's all working together for good, right? Okay, so you know that Ministry of Education currently is promoting this competency-based way of learning, right? And so that is the area that we're working in right now here in our Belizean schools. And so in replacement of what we call the regular examination, you have to do end of term integrated project. And so for Palote High School first and second form students for third term, because we are still in terms and not semesters, the integrated science part took the lead. And so basically what they had us do was urban gardening. The girls had to get seeds, and basically they targeted carrot, lettuce, cucumber, cilantro, and one other, because it's 5. And so all of us had to, help them, and they had to water, and they had to measure, and they had to grow. So all the different subject areas got a touch, right? And I was sharing with Miss that on Thursday when we had our collaborative day, Mr. Eligio, he shared with us an end product, right? The girls packaged their lettuce, right? And this was just awesome. This was just awesome to see. And one of the comments that the girls made was when they had just taken it up out of the ground, they were like, I don't know about this, but remember the whole thing with collaborative learning is that you have to touch all the different aspects, right? So when they got to package it and label it, and it looked like something that they could recognize, and they said, but this is what I buy at Save You. This is what I buy at, they were like, I did this. And Miss, sir, I'm going home to do a sandwich with my lettuce. And that's the point where you want to get them. So it is working. I am really a fan of teaching the children from now to grow their own food, and teach them the value in it, right? So I must say Palote is on board with that. I'm loving it.
Robin, you've been a nutritionist for the better part of your professional life. How difficult has it been for you to be able to impart these messages to not only students on the receiving end, but to teachers and other stakeholders in education, that you have to be able to begin somewhere in terms of perhaps curbing the mentality that we have where we consume anything that crosses our eyes?
It has been some areas, they gravitate easily towards it, and it's easy, and some we have challenges. But it really, that's the importance also of this program, looking at creating healthy habits. So the earlier we start with the habits, the more it can be sustained. So if we are starting very late with teachers, with students, it's very hard for them to adapt. So having a program like this as early as preschool is very helpful. Even primary school, by the time these kids from primary school reach high school, they would have already started putting into effect all these habits that we're pushing: hand washing, eating healthy, physical activity, gardening. So it's something that we're trying to work through with them. And also the teachers, we are also working with faculty as well to get them on board, because like Ms. mentioned, the teachers are examples. So it's hard for us to be teaching something and then the teachers are walking around with unhealthy foods or consuming unhealthy foods. So it's really a collaborated approach, and it's hard for us to also to just think about doing it alone. So our partners play a very, very big role. We have partners like agriculture on board helping to provide seedlings, trees. We have also our UN partners, PAHO, we have UNICEF also on board to help us support activities and to look at the broader scope of things, looking at minimizing childhood obesity. So there are many areas that we all come together to address, and that makes the job easier. If it was health alone, it would have been very challenging to do all of this. And even working along with the vendors, I wanted to throw that in because that's another part of the sensitization that's important. Teaching and educating vendors about how to prepare foods healthy. Even something as fried chicken, how can we make it a little better in terms of the foods? Because we can't just say, well, children won't have any foods that they like, because we will actually have chaos in the schools.
Can't eliminate chicken tenders.
Yeah, right. So we have to make sure that we still make food that they like fun, and they could actually understand that, okay, Friday might be fried chicken day, but I will have my fruits. I will have my fruits daily. I'll have a banana every day. I'll have my water. The water days are helpful. The physical activity is helpful. So all of these things play a role to tie in what we're trying to do.
How are you all working on this campaign? I know that the Ministry of Education also launched their More campaign a couple of months ago, and I think part of it is to be more healthy as a part of their initiative. Is this also something that you all are collaborating with through this initiative as well?
It ties in. I'm not sure if the other schools or the schools representative here have started to do anything for that campaign, but it ties in. The More there's a big health aspect for the More that ties right into what we're doing, which again stems from our nutrition policy, looking at creating collaborative efforts with our entities, our local partners and international partners. So everything ties in and it complements the whole of having a healthy Belize, healthy schools, healthy young people, healthy population. So we do see that the effects, and even for agriculture as well, what they are trying to do working along with the schools is all for one big goal for us to look at minimizing non-communicable diseases, promoting healthier students, and of course helps with learning. So the teams are cross-cutting across the work from the different ministries and entities.
Let's go back to you, Ms. Arthurs, in terms of perhaps what your vision would be for Buttonwood Bay Primary in terms of being able to successfully achieve this initiative or this objective.
Okay, so in order to successfully achieve this, like I said, that parental support, we need to have 100% on board. Accessibility to things that we know students would like, but it's also going to be healthy, because that's one of the challenges that we're faced with. Today, they appreciate the fruits, or they appreciate the popcorn, but after a while, they get tired of it. So coming up with new ideas. So if there are suggestions out there, you know, that can be shared with schools, or maybe even something put in place whereby schools, when they go to vendors, you know, they are given a different price as compared to regular consumers, so that when we bring these things to school, we can sell them at a price that students can afford. I remember my days in primary school, I used to get a shilling, right, or a 50 cents. Today, $1 hardly buys anything for a student, right? Because things are so expensive. But I am already seeing the changes at our school. Like I was mentioning to them earlier, with our cafeteria at school, we try to provide a balanced meal. And so we have incorporated things like mashed sweet potatoes, kalalo, like today on our menu it's kalalo. Right? So the students are exposed to different things. Fried pumpkin, they get their smoothies. But because they see others trying it, we see more students attempting to eat it as well. I even had a parent came back to me and she was so excited, like, my child, I was unable to get my child to eat this, and I see my child eating it at school, right? And others have shared the same sentiments. But if parents incorporate these at home as well, because you find that we have a lot of working parents, and one of the most accessible food is the fast food, right? The fried chicken, the fried panades, a lot of fried stuff. And these are the things that are affecting our students. It starts from very young. Some of them, as mentioned earlier, as young as in the primary school level, are already having diabetes, you know, overweight, hypertension. All of these things affect our students, and it starts from home. When we go to school, we can only do so much, but if the parents work with us, then it is going to make the lives of our students much better, and it will make it easier for them to adapt to these changes as well.
Wow. Mr. Montero, in terms of this campaign, what more can we expect to come from the Ministry of Agriculture?
Yes, I'm glad I'm listening to the conversation from my colleagues. And one of the things important for us to understand, the whole idea of healthy eating, it's a culture we need to change. And that culture can only come by everyone collaborating, the parents, the students, teachers, the school environment, key ministries, agriculture, education, and health. And I heard
We seem to have some technical difficulties. But
seed.
Oh,
just
okay.
yes.
Kindly repeat.
So one of the things that our ministry brings to the table is the whole idea of technical support to schools, introduction of gardening into schools, the skills, the different skills that teachers and students need to learn so that their crops are able to grow, and the whole idea of healthy eating as well. And because of that, and so many schools wanting to incorporate gardening into their programs, this year the NATS committee, for the first time, we launched a school garden competition. And we had 15 primary schools that enlisted to compete, and 8 high schools countrywide. So on Thursday, we already have toured the country. We were able to see excellent gardens. We were able to see the hard work and the effort and dedication that the teachers, the students, and the schools put with community involvement. And one of the things that Robin mentioned, which is very important, is using gardening as a teaching tool to promote healthy eating. So on Thursday, we'll be selecting our winners with 2 categories, primary schools and high schools. And we were happy to see some excellent gardens that were developed between December to now. And next year, we're planning to launch again our school garden competition. And we are expecting more schools to participate. So this whole concept of school gardening is very important because it will continue to contribute to the whole idea of healthy eating, so that children, they learn how to grow their own healthy foods, and so forth.
Wonderful. Yes, Miss Lacayo.
Okay, so what I'm thinking of is like Miss struck a nerve when she spoke about the vendors. Because, like, for example, right at our gate, there is a sweet cart, right? And so that has been a battle for us. And this is why the multiple approaches are so necessary. Because at the end of the day, we want our girls, for example, to make that decision, but they will only be able to do that if we start building in them. I personally like the simpler times, and I find it is something that is missing from our students' lives right now, or it's limited, and that is the family table. A lot of the children really don't get to sit and eat at home, eat with their family. And when they do, it is the fried chicken or some
Fast
unhealthy food, some fast food that was brought in. And that, all of that for me, I can see us down the road helping them to change that mindset and helping them to go back to the family table where we prepare our meals and we sit and eat and we make the choice. Make the choice. At high school, we are teaching them, at Palote at least, to make good decisions. And so I would want to see them making that choice.
To wrap up, Ms. Robin, if you would just be able to give us a synopsis of the campaign and the program and why more schools should be involved.
We are winding down to the end of the school year for one, but we still will be working with these schools, and we want to invite also other schools to not only wait for us to come and reach your school in terms of training, but start making small steps and decisions with what you can do to create healthy habits in schools. And there are many areas of healthy habits. So even if it's, okay, we'll have just natural juices at schools, that's a step. Even if we're going to say we're going to start having apples and bananas or apples or oranges and bananas at school for sale, that's a step. So let's start making small steps with our schools for us to look at healthy habits and things like even hand washing stations, having training sessions for teachers, educating vendors. There are many ways we are here to support the schools, and we as a task force are here to support. And we have been getting requests now for schools wanting presentations, wanting to do a little health fair with their faculty, with their staff, and we are glad we support this, and we want to see more of these things coming on board. So we do have 18 schools in the Belize district. We will be working along with the other schools that the Ministry of Education have as well. We are working together as partners on this initiative, so we want to make sure that we broaden the scope as much as possible so other schools can join in, because I believe if all of us can take a little step to making that healthier choice, we will be one step in a positive direction. So that's my advocacy.
Wonderful, thank you.
Perfect. Well
Thank
said.
you all, and thank you so much, Mr. Montero, for joining us via Zoom. Very important conversation to have. Thank you, ladies, so much, and best of luck.
Thank you.
We are going to take our final break, and when we come back, we will be wrapping things up. Don't go away.